you're absolutely right. Anyone can catch it, but it tends to be gay or bisexual men. And it's because one of the ways that it's transmitted is through close contact. And whilst it's not a sexually transmitted infection per se, it can be spread through the close contact of sex.
OK, so that's why it's an increasing problem in that particular demographic. Yeah. The good news in all of this is that there have been long-established treatments for poxes, smallpoxes, which this is in the same family. But don't get too excited with the good news, because the bad news is that it's getting harder and harder to get your hands on one of these vaccines. Yeah,
the smallpox vaccine has been shown to be very effective in monkeypox, but the LGBTQ plus communities have asked for around 250,000 vaccines to be available for the communities, but at present, it sounds as though we've only got about half of those available.
And there's a warning here that it could become endemic. What's the difference between endemic and a pandemic?
OK, so we've got epidemic, pandemic and endemic. Epidemic is a disease that occurs in a population, community, location. When it spreads to several countries or continents, it becomes pandemic. It's endemic if that something is a constant presence in a location. So, for example, malaria is endemic in parts of Africa.
Right.
So those are the three kind of definitions.
Right. So these warnings from LGBT plus groups are saying that, look, this is going to become endemic within our community.
Yeah.
If we don't get to grips with
it.
So
if it becomes endemic and we're about 50% short on the treatments, the reality is a lot of people are going to be getting this. And by all accounts, in many cases, quite painful virus to suffer with, not only sort of the typical shivers and things, but some nasty sort of symptoms as well.
So for most people, it is a mild illness. Of course, there are some fatalities that have occurred, but for most, it is mild. However, it can be disfiguring. It can be painful. It means days in isolation away from friends, family, and, monetary issues because of financial losses from work.
Yeah. How confident are you with the authorities getting to grips with this?
So I do think we are a step ahead of, for example, our COVID pandemic because we have a vaccine. We just need to procure more of it. And I think that's our first step in making sure that we're protecting our community.
And how can we get our hands on more? Because, I mean, I was reading reports this weekend of lines of men queuing up to try and get this for hours and hours, 3-4 hours in some cases, and some being turned away. What's being done to try and sort that out?
That's the problem. I don't know what's happening behind scenes. I'm assuming the government are procuring more through manufacturers, through pharmaceuticals. Yeah. But I don't know.
Yeah, I mean, you're a doctor at the end of the day. That's not your job.
Well, yeah,
I've got colleagues who are stressed, people that are in sexual health clinics who are saying that they don't have availability of it.
But are patients still coming to you and asking you about it? They are?
I have been having, patients asking about it.
How worried are they? How do those conversations go is what I'm thinking.
Well, you know what? I think a lot of people are aware that this is fairly mild, but they are also aware of the stigmatising issues surrounding it all. And so I think people just want to get the vaccine so that they can avoid these horrible conversations that do then have to go on to happen.
It's funny, isn't it, in the world of medicine, how certain names stick with certain illnesses. When you think of chickenpox, nobody's offended, but something about the term monkeypox that makes it sound particularly unpleasant. I do think that contributes to the taboo to say I've got monkeypox. But
the World Health Organization, weren't they going to change the name of it? Or they were, did they not in the end?
Yeah, they haven't. I mean, you're quite right, because actually it's nothing really to do with monkeys. It was found in primates at one point, but it's found in lots of different animals, and it doesn't really add to it. I don't know if they're planning to change it. I think now it's pretty integral within media, so I'm not sure how changing it now would make much difference.